And now it's time for our next expert to give their presentation. And it's the turn of Lance Baumgard, who's talking about the impact of systemic inflammation on lactational performance. Lance, really looking forward to what you have to say.
Well, thank you very much. I appreciate the opportunity. I wish we could be in the Netherlands in person. I very much enjoy stroopwafels, so I was hoping to get some of those, but hopefully next time. So, I'm going to talk today about immune activation and how it negatively affects the transition period. And then I want to challenge the audience to rethink some of these traditional dogmas. We'll go through what they are. I think we now have a better understanding of how this immune activation is really the foundation of a variety of problems that we hadn't traditionally thought of as being related to health. Okay, so let's talk a little bit about the energetics of the transition period. As the previous two speakers talked about, a lot of culling happens in the first 60 days in milk, primarily because some of these health problems here on the far right column. And the transition period is accompanied with a variety of different shifts in physiology and metabolism. In particular, there's a high non-esterified fatty acids and the resulting hyperketonemia that's associated with this. And low calcium. And for a long time, probably at least 50 to 75 years, we've believed that this high nephas and high ketones and hypocalcemia negatively affect health and cause these negative health issues over here. And only about 50% of our cows can get through the transition period without experiencing at least one of these negative outcomes. Okay, and so we've been blaming the transition or this negative energy balance for these problems for a very long time. So let's talk a little bit about what negative energy balance is. Okay, so prior to calving, and I apologize, this is in megacals instead of joules, but prior to calving, there's a small decrease in feed intake approximately about a week before. And then right at calving, of course, there's suboptimal feed intake, and this is associated with an enormous amount of energy required to synthesize milk. Okay, so the cows go into negative energy balance. It can be up to -30, -40 megajoules per day, and then, like I said, we as an industry have thought and assume that the magnitude and severity of this negative energy balance then is causing problems. So in other words, the more negative or the more severe this negative energy balance is, we believe then causes problems, ketosis, DAs, metritis, etc. Okay, so let's talk about the metabolic consequences of this negative energy balance. And on the left y-axis is dry matter intake, and this is in pounds. I apologize. And on the right y-axis, that's non-esterified fatty acids. And so prior to calving, you see this reduction in feed intake, typically observed in almost all cows. And then because of this negative energy balance, we see an increase in non-esterified fatty acids. This is the product of adipose tissue or back fat breakdown. So they go up in circulation or in the bloodstream shortly before calving, and they will stay increased in circulation for about 25 to 35 days. And again, this non-esterified fatty acids are the precursors for liver-produced ketones. Okay? So I'll just kind of go through what this traditional dogma is to make sure we're all on the same page. We, as an industry, as a global dairy industry, have long believed that high nephas, hyperketonemia, which is just an increase in blood ketones, and hypocalcemia, which is just a reduction in blood calcium, cause problems. Okay, that's what I'm trying to emphasize here to make sure we're all on the same page. We have for a long time believed that the changes in these three cause problems. Okay, so we've made a little cartoon kind of capturing what the dogma is, that in animal calves, that the mammary uptake of calcium is so extensive that blood calcium levels go down. And they mobilize adipose tissue, so blood non-esterified fatty acids go up. And the increase in non-esterified fatty acids then is responsible for the increase in blood ketones. And this, if severe enough, can cause ketosis. Okay. And then this low calcium, high NEFAs, and high ketones, then we believe, it was traditionally believed that this was responsible for the reduction in dry matter intake, reduction in feed intake. And of course, that this could cause a displaced abomasum, and that also the changes in these three, calcium, NEFAs, and BHB, caused immune suppression. In other words, it's thought that the changes in these three really caused the immune system to not be very effective, and that this immune suppression then was responsible for the increased incidence of mastitis, metritis, RP, pneumonia, etc. Okay, and then we also have often thought that high NEFAs, high ketones, and low calcium was impairing the cow's reproductive capacity. So this then explained why there was a high correlation between cows that became ketotic or had a DA or were hypocalcemic with poor reproductive performance. And ultimately, then these negative health outcomes was responsible for decreased milk yield. Okay, so that's the dogma that we've had for probably, like I said, 50 to 75 years. Global dogma in dairy. So I want to briefly challenge this dogma. These are all retrospective and observational studies that associate and correlate high NEFAs, high ketones, and hypocalcemia with the risk of these negative outcomes. And I've listed a couple different publications, but I could have listed maybe 5,000 at least. Okay, so they're correlations. They're not cause and effect experiments. But here's what we do know. After calving, non-esterified fatty acids and hyperketonemia is experienced by almost all cows, and this is also associated with low calcium. So if all cows have an increase in blood NEFAs and ketones and have some level of hypocalcemia, what is it then about these cows that have some type of problem? Why do some cows get through the transition period without experiencing any negative health events? And also, interestingly, frequently, hyperketonemia or high ketones and low blood calcium levels are correlated and mathematically associated with increased milk yield. So there's a lot of inconsistencies amongst these really mathematical correlations between these three and in a negative outcome. So I guess my question was, in our group's been thinking about this for a long time, is how, and more importantly, maybe why would high NEFAs, hyperketonemia, and hypocalcemia cause a problem? In other words, I'm asking, what's the biological plausibility? Why would evolution favor a scenario where the mother would alter her metabolism to make milk, but at the same time, these changes would endanger her ability to nourish her young, right? I don't think that makes sense to me. And really, I think there remains little evidence to suggest that NEFAs and ketones and hypocalcemia can negatively affect such large differences or such a large unconnected systems and diseases. Okay. So let's quickly talk about the dogma of ketosis. Okay, we know excessive mobilization of adipose tissue causes fatty liver and ketosis, and that the dogma is that high-producing dairy cows are more prone to this problem, so we should do everything in our power to reduce the incidence of ketosis in blood nephas. But non-esterified fatty acids and ketones are simple fuels that all animals, including humans, have been using since the beginning of time. So all animals, especially in nature, will ebb and flow out of different negative energy balances, and they use these fuels as a survival strategy. Even the simplest of creatures, like a microbe, will store fatty acids and oxidize fatty acids and create ketones when they're malnourished. So again, what would be the evolutionary advantage of utilizing a stored fuel and simultaneously compromise your own health and your ability to nourish your offspring? I just don't think it makes sense. We'll get into immune activation in a second, but immune activation reduces a person's appetite, reduces an animal's appetite, and this is highly conserved among species, even in insects. So ketogenesis, or the production of hyperketonemia, happens in a variety of different situations. Uncontrolled diabetes, starving or fasting, a hibernating animal, a migrating bird, or a person who's on a high protein, low carbohydrate diet. And importantly, it happens early lactation in almost all species. Well, my point is ketosis is normal. And it's the strategy utilized by all sorts of different species to survive periods of nutrient insufficiency. Early lactation is a period of nutrient insufficiency. So let's talk about normal metabolism of the early lactation cow. And I'm going to try to argue that high nephas and hyperketonemia is essential for maximizing milk yield in early lactation. So here we have propionate coming out of the rumen. Don't worry about the biochemistry, but propionate coming in the rumen, being made in the liver to glucose. Now, the successful transition cow has very low levels of insulin, and this allows her to mobilize large quantities of non-esterified fatty acids. Now, most of the carcass or the body can utilize non-esterified fatty acids for energy, like muscle, but importantly, some tissues cannot. For example, the central nervous system cannot. That's okay. We can convert the energy in non-esterified fatty acids into ketones. So now the animal can utilize ketones and non-esterified fatty acids for energy. This is important because now all the glucose that's coming out of the liver can be utilized for the synthesis of milk. Okay, and if you prevent her from breaking down adipose tissue or making ketones, milk production is markedly reduced. Okay, so this is normal. Now let's talk about hypocalcemia. Again, the dogma is that the mammary gland's uptake of calcium is so extensive and quick that it exceeds the homeostatic capacity to replenish it, and the animal becomes subclinically hypocalcemic. So the dogma is that we want to avoid this. Okay, so I'm not suggesting that milk fever isn't a big deal. Milk fever is an illness that we can control with pre-calving dietary strategies. I would say you could argue that the almost elimination of milk fever is maybe the largest advance in dairy nutrition in the last 30 years. And obviously, clinical hypocalcemia or milk fever is a negative outcome. Subclinical hypocalcemia is what I'm talking about. And we, as an industry, has long assumed that subclinical hypocalcemia is pathological because we believe that hypocalcemia is causing immune suppression and that this immune suppression is then causing an increased risk of disease. And so as a consequence, then we think that hypocalcemia is really the epicenter of all these negative outcomes. Like immune suppression, mastitis, milk fever, displaced abomasum, etc. And I find it hard to believe that hypocalcemia could be responsible or the foundation of all these negative health outcomes. So now let's move on a little bit now to immune activation in the transition cow. We know now because of Professor Trevisi in Italy in the last 10 years that all transition cows experience some level of inflammation. And where is this inflammation coming from? Well, obvious sources would be the mammary gland if mastitis, the uterus during metritis. We're going to try to convince you that it's also the gastrointestinal tract, and this will tie in nicely with Dr. Sanz Fernandez's presentation. And so, this is an old saying, but of course, all diseases begin with the gut. And if you have any type of intestinal issues like irritable bowel syndrome, you'll know that if the gut is not healthy, the whole body can't be healthy. So just a quick immunology 101, if an endotoxin gets through an epithelial barrier, the mammary gland, the uterus, or the gut, it's immediately attacked by what's called an LPS binding protein, and the animal experiences an inflammatory response. Now, we believe a big part of this inflammation is coming from the large intestine. And what happens during the transition period, when I think Dr. Sanz Fernandez will talk more about this in her presentation, is that soluble nutrients ends up in the large intestine. When I say soluble, what I mean is they should have been fermented up in the rumen, but they end up in the large intestine, and primarily I'm talking about starch or soluble sugars. And this rapid fermentation in the large intestine then causes hindgut acidosis. And then this is responsible for the inflammation and immune activation in some cows during the transition period. To support this, we have fecal pH. And this is looking at the reduction in feces pH before calving. Okay, this to the left of the vertical line, and to the right of the vertical red line is post-calving fecal pH. And there's almost a 0.7 unit decrease in fecal pH. So we believe that this hindgut acidosis then is associated with a variety of negative outcomes, including suboptimal feed intake. Okay, let's talk about feed intake and immune activation. Immune activation reduces feed intake across species. This is a highly conserved response, and you and I have familiarity with this. Next time you get sick, just take note of your appetite, right? Everyone loses their appetite when they get sick. And this is so highly conserved that even insects, if you immune activate a cricket, it loses its appetite. So, and we know that animals that are more inflamed also have the largest decrease in feed intake post-calving. And as a consequence of having reduced feed intake, they also have the highest non-esterified fatty acids and ketones. So our take is that inflammation is the simplest and most logical explanation of why some cows simply don't eat very well during the transition period. And this inflammation is incredibly important because increase in inflammation precedes, in some instances up to 2 to 3 weeks, precedes a clinical disease, whether it's ketosis or metritis or any type of culling. So the higher the inflammation is in early lactation can explain why some cows don't make it to 100 days in milk. Interestingly, inflammation was hypothesized to be involved with milk fever over 150 years ago. So I think, remember, I've already showed you this slide. And I've already showed you this slide where these changes are responsible for negative outcomes. Okay, I've already showed you this slide. I think we need to think about this differently. That increased non-esterified fatty acids and hyperketonemia are just simply a reflection of immune activation-induced hypophagia, or just a fancy word for reduced feed intake. So low feed intake, high NEFAs, and hyperketonemia and hypocalcemia are not causing problems. They're just simply a reflection of a problem. Okay, so here I have different immune activation opportunities, metritis, etc. Well, this causes immune activation. And then this causes inflammation. And this inflammation then, importantly, is the foundation or the common denominator behind all these other negative outcomes. Okay? And so now that, in particularly, it reduces dry matter intake. And this reduced dry matter intake then is responsible for excessive non-esterified fatty acids and fatty liver, and an increase in hyperketonemia and the eventual diagnosis of ketosis. Importantly, it also causes hypocalcemia. And we know that inflammation impairs reproduction. So the unsuccessful transition cow ends up having LPS coming from either the rumen or the large intestine or the uterus or the mammary gland. And what it really does then is it's the origin of all these negative outcomes. And of course, we know LPS, I didn't talk about glucose, but LPS causes the cows to go off feed, okay? And it has an enormous appetite for glucose. And instead of glucose being partitioned to the mammary gland, glucose is partitioned to the immune system, and the animal doesn't eat very well. And we know LPS and inflammation negatively affects the growing follicles. This explains why there's such high correlations between negative outcomes in the transition period and hypocalcemia. So you're probably wondering to yourself, okay, well, what should I do with a ketotic cow? Well, if you have two cows in the fresh pen and they're both 10 days in milk, for example, and they're both hyperketonemic, well, they could be two very different cows. For example, if you have a cow that has high ketones, she's hyperketonemic, but she's not milking well, and she's not aggressively eating. She doesn't look very good. She has cold ears. She may even have a fever, okay? You could treat her if you want. You could treat her with propylene glycol or glucose, but the real reason why she's not eating and she's hyperketonemic is because immune activation is clamping her appetite. So treating her hyperketonemia will not fix the problem. The other cow, though, she has high ketones. She's eating like a champion. She's producing large quantities of milk. Her ears are good and they're perky. She does not have a fever, right? She's the healthiest cow in the herd, in my opinion. And, leave her alone. So allow common cow husbandry to influence what you do with her. So I don't think immune activation and subsequent inflammation, I think that's a bigger issue than what we used to think. I do not think high NEFAs and ketones and hypocalcemia are necessarily bad as long as the cow is milking well and eating well. And I think it's this immune activation is the foundation really for a lot of problems that all originate on how immune activation prevents feed intake. And when the cow is trying to make a large quantities of milk and she's not eating well, then these metabolic changes are a consequence of that. They themselves aren't the problem. Anyway, I appreciate the opportunity to give my presentation. I have a fantastic team of students and alumni, and I'd be glad to take any questions.
Lance, thank you so much. That was fascinating. Before we go over to questions, I just wanted to say that some of you may have lost the sound for a short while during Lance's presentation. We apologise for that, but you can watch this again later on recording so you can catch up with what you may have missed. Jacques, I know you have a question.
Yeah, Lance, according to the new Lance Baumgart dogma, the difference between cows that are successful in transition and cows that are not so successful is the level of systemic inflammation. Now, do you believe that the ones that have high levels of systemic inflammation are simply the unlucky cows that ran into more incidents that caused systemic inflammation? Or do you believe there's also a difference in the ability of cows to deal with systemic inflammation? In other words, the constitution of some cows is different from others.
That's a great question, Jacques. So I think maybe what you're really asking is there a genetic component to an animal's ability to be tolerant of inflammation? And I don't know the answer to that question. But yeah, I tend to think it's probably more just the incidence of immune activation at the uterus, the mammary gland, and the gut. Importantly, don't forget about the lung. the lung is another source of immune activation, and I'm starting to think it has a bigger role than what we used to give it credit to. But a big part of this is management, right? Nutritional management, the cleanliness of the calving pen, paying attention to the cleanliness of your dry cows, preventing the mastitis we talked about earlier today. So I think that probably has a bigger component than the genetics of immune tolerance.
And then what about intensive feeding schedules in young calves? Many researchers around the world have shown that if you feed calves more intensively, you reduce the risk of culling and you increase the milk production later in life. Is there an element there that those calves are maybe better able to deal with systemic immune activation?
Well, that's a great question. Also, and I don't think anyone's looked at that. Are you talking about kind of aggressive feeding? So the cow first lactation is at our first calving is about 22, 21 months or something. Yeah. I'm not aware of experiments that have looked at this accelerated growth of heifers and how it affects future immune activation. I would say that in general, fast growing and high milk yield can only occur in a healthy animal. In other words, high milk production can only occur in the absence of stress. So, high production, I think Anka was kind of referring to this earlier, is not stressful. It can only occur actually in the absence of immune activation or the absence of other stressors. Probably the same way of fast-growing heifers as well.
Okay, thank you, Lance.
Thank you.
We have a lot of questions coming in from viewers. Here's one for you. Is it possible to inhibit inflammation, improve performance, and to reduce the risk of diseases secondary to systemic inflammation?
Very good point. In fact, there are multiple groups in the world working on essentially utilizing anti-inflammatories in the transition period with the hopes of improving production and decreasing the incidence of negative outcomes. In my opinion, in the data on those, some of it is quite promising and some of it is not. So our approach, I think, is more on prevention of immune activation. Right? We know immune activation occurs prior to the inflammatory response. So instead of trying to prevent the inflammatory response, instead of trying to blunt or minimize the inflammatory response, we think a better strategy is to prevent the immune activation in the first place. And again, this goes back to a lot of husbandry management issues, nutritional management, and the cleanliness of different areas of the barns.
Super, thank you. And another question for you is, what do you think about gut, intestinal in brackets, microbiota exchange in young calves?
So one more time, about dirt?
No. What do you think about gut microbiota exchange in young calves?
Oh, okay, interesting. So you would provide some type of microflora to calves, presumably from the donor calves would have been healthy. Is that what you mean?
Yes.
Yeah. I think there's a lot of opportunities there. This area is still in its infancy, but we do that with lactating cows, right? You have a lactating cow that has kind of a dead rumen or a static rumen, and you transplant some rumen contents from a healthy cow into the sick cow, and oftentimes see positive results. I think there's a lot of opportunity there. I think it's still in its infancy, so I'm not sure, what the long term will be on that. But the host itself has a huge impact on the microbiota or the microbiome within the GI tract. So, depending upon how long, I don't know, it'll be interesting to see what this looks like in 5 years.
Super. We'll keep our eyes open. A final question for you then, Lance. It comes from Seamus. Can you identify the cows that are likely to have higher inflammation early?
Well, when you say early, I think you probably maybe even mean before calving. And I get asked that a lot. Measuring inflammation is difficult. You need fancy equipment and laboratory assays. But the best indicator that I think a producer can use is just general cow appearance and feed intake. Right? If the cow is eating well and aggressively coming to the bunk or out on pasture, and milking well, then you can be pretty confident that those are healthy cows. So, training employees to be able to detect cows that are not looking good and are not eating well, I think will pay large dividends, because those are the cows you want to pay close attention to.
Great. Thank you so much for your time today, Lance. That was fabulous.
Awesome.